Hello, my menopause maidens, and welcome back to the ATM channel, All Things Menopause. Okay, so we are talking this week about body weight changes with menopause. Last night, I gave you some nuggets about body weight changes in general, tapped a little bit into how being overweight can cause comorbid conditions. And tonight we're going to start with some definitions, giving you information on what's considered normal BMI all the way through being severely obese. We're also going to talk about the risk of being overweight. And we're going to wrap this up with giving you some optimization of body weight, how decreasing these little increment, small changes in your body weight, how it can play such a huge role in your overall health. So why body weight? Because many of us females who are experiencing menopausal changes, this is a struggle for us. This is a real struggle for me as well. All of my life, I want to say that I have been considered to be at a normal weight. But when I get these numbers off, I actually fall into the overweight category. Not real happy about it, but I am making some changes to improve those numbers, and I'm going to encourage you to do the same. Okay, so here are those numbers we talked about that I said I would give you about the BMI. What is considered a normal BMI? A normal BMI is considered between 18.5 and 24.9. So the BMI falls between 18.5 and 24.9. You are considered to have a normal weight. Okay, anywhere in that range. Now, if your BMI is less than 18.5, you're considered to be underweight. All right. If your BMI falls between 25 and 29.9, you are considered to be overweight. I just told you that's where I fall in that category. And so the overweight and beyond category for many menopausal female is a true struggle. And, guys, we got to do what we can to try to mitigate those comorbidities that may happen with being overweight. All right. So if your BMI is greater than 30, you're considered to be obese. Not a pretty word. Nobody goes around and go, oh, she's so obese. It doesn't sound cute at all. Okay. Not even overweight. Oh, she's so overweight. It doesn't sound cute. All right. So we got to do something about that, right? Right. Okay. If your BMI is greater than 40 or above, you're considered to be severely obese. Now, you can go online, go to Google, how to calculate my BMI. It'll give you what your numbers are. You put in your height, you put in your weight, and hit the button, calculate my BMI. It'll tell you exactly where you are. And also in that little website, if you look that up, it'll give you a few more nuggets about weight in general. Okay. So what are the risks of being overweight? And I'm not just talking to you, I'm talking to me too. And these are risks that I already know about. That's why I am doing things to try to mitigate those risks. And that's why I am encouraging every premenopausal, perimenopausal, postmenopausal female to follow suit so we can be at the healthiest state that we can be at. So risk of being overweight, comorbidities can develop. Things like cardiovascular disease, type 2 diabetes, high blood pressure, talked about osteoarthritis last night, like joint pain. Several cancers are associated with being overweight or being obese, and being overweight and obese can lead to premature mortality. Because if you start having a lot of problems with your health, heart disease, diabetes, and those things are not well managed, well controlled, it can lead to you maybe leaving this earth sooner than you want to because we're not taking care of our bodies. All righty. So statistically, I always say that word like terribly, but statistically, postmenopausal females who are also overweight have a higher risk of developing breast cancer than postmenopausal females who are at a normal weight. I'm going to say it again. Postmenopausal females who are overweight have a higher risk of developing breast cancer than postmenopausal females who are at a normal weight. A really good reason for weight reduction or to get to a normal weight range. Okay, another risk of being overweight for menopausal females, perimenopausal females in general, is if you're overweight, you're perimenopausal, then you may experience more frequent and more severe hot flashes. Happens more in the perimenopausal stage of the journey, but being overweight, more frequent and severe hot flashes. You know what a hot flash is? You heard folks talk about them. You feel like there's like internal, infernal fire burning inside of you, and there is just no way to quench it. Just with time that sucker passed through is how you get over it. Having a private summer all the time is not fun, but if you're overweight, you may have that private summer more severe and more frequently. Another good reason to have some weight reduction. I talked briefly in the BMIs about having BMI of less than 18.5, being underweight. That predisposes females to develop what we call osteoporosis or osteopenia. It just weaker, thinner bones. And, you hear about women falling down, breaking a hip because they have osteoporosis, osteopenia. If you're underweight, you need to normalize your weight out, get the weight up some. Can't be talking about weight gain, but get their weight to a normal range to mitigate your chances to develop osteoporosis. Okay, so optimization of body weight. So optimizing your body weight to, get into more of a normal range. We as healthcare providers always tell our patients, hey, eat healthy and exercise. You probably heard that your whole freaking life. Eat healthy and exercise, even as kids. What does that look like, really? It really looks like taking in more fruit and vegetables, fresh fruit and vegetables. If you can't get fresh, do it frozen. If you're into canned goods, especially vegetables, pour the juice off, rinse them out really well before you cook them and get all that extra sodium off before you cook it. But fresh fruit and vegetables, leaner cuts of meat, increasing your fiber intake, drinking plenty of water, and doing at least 150 minutes of cardiovascular exercise a week, which is about 30 minutes, 5 days a week. Okay. Menopausal females, premenopausal, postmenopausal females, lifting weights is going to help to reduce weight, helps with weight reduction, especially in the perimenopausal, menopausal stage. Weightlifting is highly recommended, not only just for weight reduction, but also for bone health, okay? And because we lose that adipose tissue and we have less muscle mass, it helps to build that muscle mass back up as well. Okay, so let's talk about the significance of having some moderate weight loss and what those numbers may look like. If you sustain a 3% weight loss, okay, that leads to better glycemic control. If you have diabetes or don't have diabetes, those spikes in blood sugar, if you have a 3% weight loss that's sustained, better control of that blood sugar, and also improving your cholesterol numbers and decreasing your risk for diabetes. 3%, what does that look like? Let's say you weigh 175, okay? 3% of 175 is a 5.2 pound reduction in your weight, okay? Not a big number, absolutely doable. It takes time. I know I said that. I know I told y'all I've only lost 3 pounds in the last 2 months, but this is doable, okay? All right. A 5% reduction in the weight. Same things as we talked about before, improving glycemic control, improving cholesterol numbers, decreasing diabetes risk, but in conjunction with that, better control of your blood pressure, better liver function, and decreasing or mitigating the chances of fatty liver disease, okay? Also, 5% reduction, decreasing chronic pain, and decreasing the need for medications to lower your blood pressure and to lower your cholesterol. Just 5% reduction in your weight, okay? A 7% reduction in your weight can lead to those same things I just talked about, but also it decreases the progression to developing type 2 diabetes by 58%. That is a huge number. So that's reduction by at least 7%, sustained. So greater than 6 months and over a 4-year period of time, a 58% reduction in the progression to type 2 diabetes. And for every kilogram of weight that you lose, you have a 16% reduction in your risk of developing diabetes. And so for those of you who don't do kilograms like myself, 2.2 pounds equals 1 kilogram. So if you lose 2.2 pounds, your risk for developing type 2 diabetes is mitigated by at least 16%. Okay, so those are my nuggets for you for tonight. I'm talking about weight and body changes. Tomorrow, we're going to talk about behavioral therapy that may affect, weight changes, helping with weight reduction, and then also how sleep affects weight. Again, if you guys have any questions for me, please email me at askmissbald, menopausedoctor@gmail.com. And the Miss is just MS, ASKMSBALD. Thanks for tuning in to my channel. I hope you have some nuggets. You hope you learned a few things, and I hope you share with your friends, because like I said, this menopause journey that we're on should be our best life journey, with the highest quality of life that we can have. So share, subscribe. Guys, have a great evening. God bless and good night.